Hi, my name's Todd Lonie and I'm from Staff Physio. Today I'm here at Patterson Stadium to talk to you about knee pain, which is one of our most common injuries coming through our clinic. Even our own AFL professional athletes get this quite regularly as well. The first question to ask yourself is, how did the knee pain occur? Was there a fall or twist on the knee, or was there an impact to the knee region? Either way, there could be potential damage to the bone, the ligaments, or even cartilage in the knee. Not common to the general population, but you will hear about them through the media with our AFL players, is the ACL tear. Generally, there are two types of ways that an ACL tear can occur. One, by planting your foot and bending your knee and twisting it, and the other by overextending or hyperextending the knee. These type of movements that I just described can cause damage to other parts of your knee as well, including other ligaments or cartilage or any in the knee region, and if this pain doesn't settle down quickly, it's good to go see a physio as soon as possible. Most commonly though, knee pain comes on gradually. Sometimes you won't even know why this knee pain has occurred, but sometimes we also look at it, what have you done recently? Have you suddenly increased your running exercise and increased that intensity, or even just incorporated some new exercises into your routine? The most common cause of this pain is in the patellofemoral joint. Best news is that physiotherapy can greatly help you with this type of injury. This type of pain can occur anywhere around your knee region, whether it's under the kneecap, below or above, or even to the side of the kneecap as well. Through physiotherapy, we often identify muscle weaknesses or imbalances, and through this sort of strengthening programs and obviously loosening up through the areas as well, we can definitely get you back on track quickly. A few great exercises that you can try yourself at home to help with this type of injury. I'll have my colleague Lara here to help us demonstrate.
When you're ready.
Okay, so one such exercise that we can try at home is a nice simple lunge. So as Lara will demonstrate here, taking a step forward about shoulder width apart, hands on your hips there, trying to keep your pelvis in a nice neutral position, slowly lowering your knee down. Basically what you want to try and aim for here is on the front knee here, try to aim over the top of your second toe. Nice and gentle, nice and slowly, nice and controlled movement basically. Another exercise that we can try is a simple bridging type of exercise. As Lara is already situated on the ground here, what we like to have is our feet close to our backside, also our feet kind of shoulder width apart there, so not to get completely together. Arms on the side here, just giving yourself a little bit of balance as well. What you first want to do is tilt your pelvis backwards to try and flatten out your lower back here. Push through your heels and lift your bottom up off the grounds. You want to try and keep this hip area nice and controlled, and then up and down lowering as you go. Good. A simple way to progress this exercise, if you feel this is quite too easy for you, just bringing your arms up onto your chest. Good, so you've got no more balancing point here, you're just focusing all your strength through your hip control there. If your knee condition doesn't settle quickly, with some self-maintenance exercises at home, make sure you come to Staff Physio as soon as possible and we'll get you on the track straight away. Another form of knee pain that we generally see come through the doors at Staff Physio is a condition called jumper's knee or patellar tendinopathy. This kind of condition presents with pain at the bottom of the patella and usually comes about with an increase in running or jumping activity. What is often misunderstood about the condition of jumper's knees is that rest does not help with this condition. A specific strength and conditioning sort of exercise program is exactly what you need and critical for the rehab of this tricky type of injury. What is often misunderstood about this knee condition is that degeneration actually occurs and rest does not always help this. A modified training program specifically can help your rehab and get you through this tricky time ahead. As a starting point for your rehab, what you should do is ease off your jumping or your running activities that may have brought on this pain and really focus on a strengthening program for the lower limb, in particular quadriceps. Try some shallow squats or shallow lunges and also back off on the stretching as well, because sometimes this stretch on the tendon can aggravate the actual injury as well. Once your knee pain settles down in the region, try to progress yourself onto single leg squats or even a jump landing activity. If you're unsure about any of this, by all means please come down to Staff Physio and get in contact and we'll run you through ourselves. Thanks for watching today's video on knee pain. If you have any issues or injuries sounding similar to this, by all means please come down to Staff Physio and get in contact. My name's Todd Lonie. All the best for your training and rehab.